It's the Becky and Boca Show, coming to you every Thursday night from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. Hello, welcome to the Becky and Boca Show. I am here with Dr. Elbert Vaca, plastic surgeon, new associate with Dr. Stephen Fagan, ocular plastic surgeon, right here in Boca Raton. We're in their offices, and I want to welcome him to Boca Raton, and we're going to hear what he's all about. But first of all, I want to explain, we wore masks coming in, we're socially distanced, I do a very safe set, so everything's clean, everything's good. You feel comfortable?
Very.
Okay. Okay, so you are a plastic surgeon, right? And you started with Dr. Fagan how long ago?
So back in September.
In September?
Yes.
Okay, and where are you from?
So I was born in California, moved back to Ecuador, which is where all my family's from.
Oh, wow.
Came back and moved back to Florida, and then did the whole tour of the country. Training is pretty extensive. So
yes,
was at University of Florida, then I was at Johns Hopkins for med school, then at Northwestern in Chicago for 7 years.
Very
and
impressive
now I'm back.
places.
Now I'm back.
Wow.
So excited to be here.
Okay, so tell us a little bit about your training.
Training has changed. The old school way used to be there was no direct plastic surgery training. You had to do general surgery training, and then if you wanted to pursue plastic surgery, do a fellowship. Mm-hmm. And hence that's why they have MD/FACS, which was common for pretty much every plastic surgeon that was before the 90s or so. And then they have integrated, which means I did 7 years of plastic surgery training after med school, directly into plastic surgery.
That's a long time.
Yeah. So, I mean, there's a lot to know. So back in the day, they would do GI surgery, vascular surgery, and then they would do maybe 2 years of plastic surgery training from cleft lip, palate, aesthetics. So it's a lot to cram in to that short time frame. Because nowadays you do 7 years where you still do ICU, I did transplant surgery, vascular, neurosurgery exposure, but you have a much approximately 6 years of plastic surgery exposure.
Wow.
Because there's just so much to know. Everything's advanced so much.
Right.
From hand surgery to
a lot going on.
Breast reconstruction, there's a lot.
Yeah. So
that's why nowadays a lot of surgeons will not be fellowship trained because they did a 7-year-long plastic surgery training.
So let me understand this. 4 years in undergrad, and how long in med school?
4 years.
And then another 7 years on top of that?
7 years in plastics.
That's a long time to be in school.
And then some people will do an additional year fellowship.
An additional fellowship.
Well, I try to blast my way through it.
Yeah, I know. Plus you probably got little tricks.
No. But it's quite some time. But that's what it takes. There's a lot to know.
Everything.
So do face, breast, and body. Early on, I was considering going into neurosurgery. Thankfully, I was very blessed at being at Hopkins, which was sort of the mecca of all big surgical specialties. Actually was in the OR at the time with Ben Carson and some of these other people.
Wow.
But pretty early on, I sort of went to aesthetics. And it just what really drew me to it was just the ability to think on your feet. Every case is just a little bit different. And I think a lot of portions of medicine, you're taking care of patients when they're during some of the toughest times in their life, but plastics gave you sort of the other side of the coin, where you're just really getting them back to normalcy, back to happiness, and I really found that gratifying. And then went down that path, met some great people, ended up being at Northwestern, which honestly was one of the best possible experiences. High volume aesthetic place, and now I'm back here.
Wow. So is Boca Raton a place you always wanted to be, or?
This is where my wife's family is from.
Oh, fantastic. Yeah. Oh, that's great. Well, it is a great place.
Yeah.
It's a great place. Okay, so tell me a little bit about what you do here.
So I was lucky enough for Dr. Fagan to bring me on, and just a brief background. I did a lot of research in eyelid surgery. Of course, he's one of the titans in the industry.
Yes.
And his name would come up again and again, and I'd cite him all the time, and lo and behold, now I'm here.
Wow.
But now, of course, I'm able to provide the full spectrum of cosmetic surgery. Of course, Dr. Fagan is very hyper-specialized in doing injectables and eyelid surgery. So now with the addition of me, offer the full complement of head to toe, from face to frontaloplasty, breast, body procedures.
Okay, I see the logic behind this now. Do you also do cosmetic
Yes, injectables as well.
And what do you think of Boca Raton as a place to be doing cosmetic surgery? Because I think this is kind of a mecca for that.
Yes, as is all South Florida. You know, there
Right,
is like Southern
Miami.
California and New York, but yeah, this is definitely one of the hot spots. You know, what can I say? It's a beautiful place to live. There's obviously high demand. I'm happy to be back, and what is there not to love?
Yeah, yeah. And no, you have a wife and children, I believe,
Yes,
right?
2 kids.
Oh, how old are they?
So I have a 3-year-old, and currently he's 9 months old.
Oh my goodness.
So a girl and a boy.
That's perfect.
Yeah, so
okay. So
raising him with a family here.
That's great. What a great place to do that.
Yeah.
Wow. Tell me a little bit about how the virus is affecting the practice, because I know Dr. Fagan was telling me that he has very stringent protocols in place here in the office, and I know some people are kind of uncomfortable to get their injectables, but Boca women will get their injectables. Believe me.
It's like I think with every industry and craft, it's been a trial and error type of thing. But surprisingly, cosmetic surgery has been alive and well.
I know that.
And initially, obviously, we've implemented a lot of protocols from social distancing, masks, gloves, high filtration UV filters in all the rooms. But after the initial phase, I think, of adjustment and everyone's sort of getting up to speed with all these protocols, been
well, I know
along.
People are probably wondering that haven't gotten injectables since the virus came about. You have to take your mask off, obviously, to get the facial injectables. So how is the patient protected, and how are you protected?
Yeah, so the filtration system that we have, so we have very high efficiency turnover of the ACO, which is also sanitized using UV.
Ooh,
we
great.
ourselves wear the masks as well, gloves, also wear face shields while we do the injectable procedures.
I know what you were saying, that plastic surgery is kind of booming now. I know that because I talked to a lot of the doctors in town, and it seems like this whole thing of having to hide away and not really go out in public has worked in favor of women that want to get cosmetic procedures done. Nobody's going to ask you where you've been.
It's extremely true, because one of the other limiting factors is people finding the time and the downtime for recovery, and obviously in different times.
There really was no social season this year in Boca Raton.
Yes.
Usually there's balls and galas and all that, so you got to time it during the off season.
For
But
better or worse, but
but now nobody's going to those events anyway, so it is a great time to do something like that.
Yeah, absolutely.
But hopefully within the next few months we'll
we'll see the new semblance of normalcy, but little by little.
I think I'm going to wear my mask for a while out in public. I heard that there's not much flu virus this year because people are wearing masks.
Yeah, people have, it's been quite the social experiment, I think, for many other specialties. Of course, we're in plastic surgery, but people investigating other diseases to, there are just so many things that have been altered due to this. At the same time, it's curtailed a lot of other infectious diseases.
I know. Maybe we'll wear masks for a while.
Yeah, but I definitely see that being part of the new normal, at least for a while.
Yeah. Okay, so you said you do face, breast, and body. What other body plastic surgeries do you do? So
breast augmentation, lift.
Anything new in breast augmentation? I know.
Well, the biggest topic, of course, there's our field is constantly evolving. That's what I really love about plastics. So along with that is a lot of new technologies and better understanding of just the process of aging. But in terms of breast, the big thing or hot topic has been just breast implant technology and some of the potential downsides. Of course, back in the 90s, early 2000s, it was all about whether silicone breast implants can cause certain either autoimmune phenomena or, but now what's been really come to light is the potential association with certain rare forms of cancer.
Ooh.
Where it was more based on the breast implant texture. So in other words, the rougher the implant capsule is, it just elicits some form of an immune response, which if that goes unchecked over a prolonged period of time, the body can then form or go into overdrive and then produce this cancer. So that's really been one of the big hot topics.
How do you prevent that when you're doing?
So nowadays, essentially avoiding textured breast implants. So those were very popular in Europe for some time, and they have some distinct advantages to them. But obviously, as you learn over time, of course, the risks now, and you have to find that fine sweet spot. So What's been the big movement in at least the last 2 years or so is where a lot of women are getting their breast implants replaced, the ones that previously had textured implants, due to the fear of that potential risk going back to smooth.
Oh, I did not know that. Very interesting.
Yes.
Okay, so
that's
something
the
new.
big sort of new thing, hot topic.
Okay, and what about necks? Do you do necks? Because
yes.
all my female friends, that's their big gripe. Do you do just a neck lift, or do you have to do it in conjunction with facelift?
Yeah, so that's another sort of topic of controversy, I think, especially amongst the general public.
I'm sure a lot of patients come in and say they just want to do the neck.
Yeah, and understandably so. You know, people always want to do the least intervention to get also expedite recovery. But however, when you analyze the face, the issue is what's really that bothers the patient. Typically, when they say their neck bothers them, in most patients, there are always exceptions. Typically, what also happens is the bottom of the face begins to square off, or what people call the jowls, where they get the overhang.
Yes.
The problem with just an isolated neck lift in general, what that means is usually there's an incision behind the ear, sometimes beneath the chin. It's very difficult to physically get to actually correct the jowls.
Oh.
So that's why when people talk about a facelift, or the face component means an incision that's actually in front of the ear.
I see.
And so when people say full facelift, it's technically considered a combo of a face and neck lift, but it gives you the best power.
I would imagine you have a lot of people that come in and say, I don't want a full facelift, I just want you to fix my neck.
And I think that the more fundamental question is, what is it that bugs you? And that will just dictate what you need to address. Yeah.
Okay.
So ultimately, a full facelift involves correcting the neck, but then also the lower face, the jowls, and a bit of the lower part of the smile lines.
Okay. You said something about you learned a function of aging and how that affects people.
Well, so along the theme of what have been sort of the new advancements in terms of our knowledge of aesthetic surgery, it's really the underlying principle of what happens to the face as we age. So the old school thought used to be more just remove and tighten things, and that was based on the thought that it was just that skin would sag and you just had to tighten it. But it's really a better understanding now that we actually lose volume with age. Hence, there's also been the introduction of fillers to address that one component. But in the facelift world, what has been sort of the new wave in the last decade or so has been the addition of fat. So using your own fat as filler. So it's not only tightening the deeper structures.
So you take fat out of a person, their abdomen?
So wherever they have it.
Okay, and
so
you put it in the
typically
face.
It's the belly. Yes.
And does that last?
Yeah. So it's all a question of at what time frame does it last. So or how far out. So it's your own cells. They're living cells. You transfer them, and you just give them a new home to live. But ultimately, when you move cells, some of them survive and some of them don't. So it's really after 3 or 6 months that you can tell how much of that fat survived.
Okay.
But on average, about half of it does.
Okay.
So you always tend to overdo it a little bit with a fat, with the understanding that some of it doesn't survive.
Can you do fat transfer without doing a facelift?
Yes,
I mean, can
absolutely.
you do it in lieu of
Yeah,
injecting?
absolutely.
Oh, that's interesting.
So it's just, again, typically it comes to just considering 3 components. What's going on with the skin, what's going on with the deeper structures, and where is the volume loss. So typically if you have someone that's a bit younger, good skin tone, hasn't really developed jowls or some other concerns, but let's just say their cheekbones are a little deflated or they're complaining of smile lines, fat is a good alternative, as is filler.
Is that like a simple outpatient procedure?
Yes.
So, wow, that's interesting.
So that's also one of the beauties. Using your own fat as a filler, it can be done as a in-office procedure. Just sedation, some numbing medicine.
I think there are a lot of people out there that are going to like that idea.
Yeah, so it's really become much more popular and a lot less downtime.
So would the idea be then, if you do that, you don't have to go back for regular fillers?
Yes, because it lasts much longer. So typically with fillers, most patients go somewhere around 12 months or so between treatments, but you're using your own fat cells. It's actually living tissue. So it takes and essentially continues to age with you as your other tissue would. So typically, we say expectation maybe around 5 years plus.
Oh, wow. And then you can just do it again? Oh, I like that idea.
So it's much more longevity. And the other pro is also it's your own tissue. So there are sometimes immune reactions with some of the filler products where some people can get inflammation or swelling. In this case, it's your own tissue. So you really avoid a lot of that.
Right. Okay, so let me ask you this. Is it done just with a syringe or do you have to cut?
Yes, syringe. So it's little poke holes that heal inconspicuously. It's just like using a little syringe
Amazing.
poke. So there are really a lot
I think
of pros
this
to
is the
it.
takeaway of this interview.
Yeah, there are really a lot of pros to it.
Wow.
So it's become much
Okay.
more popular because it's very powerful.
Do you do fat injections in lips as
Yes.
as a standalone procedure? Can someone
Yes,
do that?
can be done as a standalone procedure.
Okay, tell me about that.
So important things to know though. Fat is not filler. And what I'm getting at is more what it can accomplish. Fat is your own. It's natural. It's softer. Filler, you have many different options of types of filler. So some fillers can be more viscous. In other words, what that means, it can give you a little bit more of a pop or
Right.
projection. So if someone wants more subtle lip augmentation, fat is a great way to go.
I was going to ask you, is there one reason you would
Yeah.
go with the fat over the...
And some of it all depends on the patient. And to be honest, I think it's a bit different based on demographic. Typically more patients in their 20s, 30s tend to want to go for a little bit more of an
Big
augmented
lips.
look.
Yes.
Now, fat is, using fat for lip augmentation is typically a pretty common complement during facelift. So we commonly do that as the rest of the face ages, the lips also tend to thin out. We will
Tell me
often
about
put
it.
a little bit. We'll often put a little bit of
all
fat in
about
the
that.
lips at the same time, just because we're there, we have
Right.
it. Why not use it?
While you're doing a whole
Yeah.
full face. Yeah. And it can be used in the cheeks. What about the jawline?
Yeah, jawline it can be used as
And
well.
you said hair?
People use smile lines. It can even be done for moderate amount of chin augmentation. So some patients who complain or concerned that their chin looks a little bit small,
Interesting.
it can just to give you a little bit more projection.
Okay, and is the same true of the jaw? Like at some point, you just might need a jaw implant. But how much can you do with fat?
Yeah, typically, this will vary person to person what they say, but you expect maybe about half a centimeter or so of augmentation, which is a little less than
Okay.
quarter millimeter or quarter inch. Excuse me. But of course, a chin implant is much more powerful if someone needs a bit more of a
Yeah,
boost.
now I don't know if I'm thinking chin implant or jaw implant. What is it when you correct this whole area here?
So they call mandibular contouring.
Okay.
That's sort of a catchphrase for a wide array of different manipulations of the shape of the jaw itself.
Right.
Typically, the most common is a chin implant, sort of at the peak right in the center.
Okay.
But then it's become very popular, for example, in masculinization procedures. For example, where men want sort of a wider jaw.
What did
And
you
so-
say? Masculine?
So enhancing male features.
Okay.
That's the best way to put it.
I like that. So
And
you
so-
can give someone a square jaw. Like
So
a
yeah,
Brad
those can be
Pitt
done as
square
well.
Jaw.
So typically, but that can be done either with facial implants or fillers can be used as well.
And how much downtime is there with facial implants? Is that like...
Well, if it's just a facial implant procedure, say 2 to 3 weeks.
Oh, that's not
On
bad
average
at all.
for most things. Of course, healing continues, but
Yeah.
in the point where about 80-90% of the swelling is gone and people can go out in public and not really notice approximately that
Wow.
range.
That's not bad at all. Okay, any other goodies that people might want to know about?
Well, those really are, I think, the main points of progress in plastic surgery, is just understanding the volume component. In other words, either via fat
Right.
grafting, use of implants, which really
And you're
gives
right,
you a
that's
better
something
result.
people didn't used to worry about, and then you'd see the people that just had like the skin stretched over the skull,
Yes.
basically.
Yes,
And that's not a good
that's
look.
unfortunately, when people think of facelift, they think of the worst possible example because
Yes.
that's just the one that stands out in their mind.
Yep.
But we've evolved quite a bit from that, and as long as you're careful and conscientious about some of those pitfalls, that's what it takes to get a
People
great
look
result.
very natural these
Yes.
days.
Yes.
Okay, what other kind of body plastic surgery do you do besides breasts?
So tummy tucks, body contouring, which essentially means just reshaping the body, typically via liposuction. Of course, some of the new things that are in vogue is also what they call BBL, which they call Brazilian butt lift.
Oh,
which
yes.
is, to be honest, it's more of a misnomer because there's really not any real lift component to it, more than just taking fat away from some locations and re-injecting it in others.
Oh, so you're just recontouring it.
Yeah. So for example, if you have someone with a frame that's a little bit more square, it's doing liposuction maybe for more the waistline area, and then redistributing some of the fat, usually more to the buttock or hip area. So in other words, to give more hourglass type of shape. So it's just a rebalancing type of procedure, the best way to think about it.
And is that outpatient or is that...
Yeah, it's really outpatient. In outpatient surgery center, people go the same day. Every once in a while, if someone has a little bit more invasive procedure or other things done at the same time, then they may stay overnight either at a care facility.
Okay, so your patients, for example, if they're getting maybe a full facelift, you would keep them overnight?
Oh, no, typically they go home.
They go home?
Sometimes it's based on patient preference, or if they had another conjoined procedure, and then we just sort of balance and have that discussion with the patient.
Okay, so it's not that big of an inconvenience
Yeah,
anymore.
the majority, by far, the majority of people can go home the same.
Okay, any other body procedures that you do? I know there's all sorts of stuff going on.
Yeah, there are thigh lifts, arm lifts. There are all kinds of all kinds of procedures. But the trade-off with some of those procedures though is scars. But some people heal better than others. Obviously, we try to put them as concealed of a place. And the art of plastic surgery, I think, is making a profound change, but leaving as little evidence that you were actually there.
Right. Nobody
That's
should
really
know.
the whole trick of it.
Your best work goes unnoticed.
Yep.
Wow.
Absolutely.
Okay. Okay, so you covered faces, breasts, tummy tuck, Brazilian butt lift, arms, thighs, anything else?
Plastics involves literally head to toe. There's a lot to know.
So what's your favorite thing to do? What's your favorite surgery?
I love face rhinoplasty.
Rhinoplasty. Okay.
They just, what I enjoy about it, it's just the nuance of reshaping, and it's just a matter of millimeters. There's a lot of art to it.
And it can make such a difference.
It really can. It really can. Because it's not just reshaping the nose, it's keeping in mind how that affects the rest of the facial proportions and balance.
Exactly.
Because it's a huge influence. A nose on one person may look great, on another that same nose.
Yep.
It may not. So.
Wow. Yeah. Any new trends in plastic surgery that we should know about?
For better or worse, it's the overdone look. Of course, anytime a new technology comes onto the market, of course, Dr. Fagan will know better than pretty much anyone in the country. Some people will overdo it.
Yes.
So that has been, of course, a trend.
Some people want to look overdone. I don't really understand that.
Some
that
do.
thought process.
And it requires, again, that balance of you coming to meet with your surgeon, and you being on the same page. But by far, I know Dr. Fagan and my aesthetic is to try to keep it more natural.
Very natural look.
And it really comes to your choice of product, the volume of the product you use, and just, again, trying to go for a little bit more natural look. It can be easily overdone.
Yes, you see a lot of that around here.
Unfortunately, yes.
I'm sure you know that. Okay, so how do you like this practice? I think this is a great place to land.
Honestly, I couldn't be happier.
Yeah.
It's not, even besides the academic component, being involved with Dr. Fagan, who's honestly one of the world leaders. His reputation precedes him.
I know.
But also beyond that, I'm here next to my family, back to what I call my home base, and best combo.
It worked out great.
Yeah,
huh?
yeah. It honestly did.
Wonderful. Well, welcome to Boca Raton, or
appreciate
welcome
it.
back. And I'm sure your wife's happy to be here. You say her family's here.
Oh yeah.
Yeah.
Oh yeah.
That's
we have
nice.
grandparents
Oh,
on
that's
both sides
wonderful
to help out.
for the kids.
Yeah.
So it must be nice to be in a warm climate again.
Yes. I'm originally from more climate. I mean, Ecuador is on the equator, pretty much as warm as it gets. Was in Southern California, Florida, did the whole tour of the cold parts of the country.
Yeah, how'd you like that?
To be honest, it's a great learning experience.
I'm from Chicago.
Is. Oh, really?
And, I know that I know how lucky we are down here. Sometimes people that are from Florida or a warm climate don't appreciate it. But you go up there right now, well, you know.
Yes. But you also learn other things. There are different aspects of cultural things in every part of the country that you live, and it just teaches you something beyond just education. Just about people and the way things flow in different locations. So.
Okay, well, thank you very much. It was wonderful meeting you. I'm so glad
likewise.
you're here with Dr. Fagan. This is a great place to be. And everybody looking for a new plastic surgeon, there's a new guy in town.
Well, I appreciate you having me. So it's been a pleasure.
Okay, well, thank you. And see everybody next week. Bye-bye.